Okay. So today what we are going to cover is we are basically going to cover evaluation of a patient with testicular mass. Okay, so testicular mass we are going to cover in the 2 days. Today we are going to talk about the evaluation of a patient, and tomorrow, the next session, I think it's on 15th or 16th. There we are going to talk about the management of a patient with a testicular mass. Okay, so yeah, good to see you, Bikesh and Jivita. Good to see you. Can you guys just unmute yourself and say hello?
Yes, sir. Hi, sir.
Yeah, Jivita, hi. Bikesh, can you please unmute yourself for a second?
Hello.
Yeah, hi. Okay, so whenever I talk about a testicular mass, what do you think? What comes in your mind? Like, what are the differential diagnoses of a testicular mass?
Uh, hydrocele hernia.
Okay,
Oh,
Epididymoarthritis.
any
epididymoarthritis. Okay, what else?
malignant.
Okay. See, get obviously. So what you need to understand, every time somebody asks you a differential diagnosis, you really don't have to say everything. For example, the answers which you gave me, hernia is not a testicular swelling, it's an inguinoscrotal swelling. Okay. In hernia, you can palpate the testes separately from the swelling. So if you utter this in your final exam, if at all there is some khadus external, he might fail you. Okay, so think I asked very, like, obviously I'm not here to kind of pull your leg or something, which they will do in your final exams or something like that. But when you talk about the testicular mass, the two main differentials which basically come a tense hydrocele, not the secondary, the primary hydrocele, a tense hydrocele or a hematocele or a calcified hydrocele or something like that in that variant, or a testicular malignancy. These are the differentials of your testicular mass. Now, epididymoarthritis, well, yes, it will be painful testicular swelling. You can say that at the last, but hernia, no, not definitely. Okay, you guys agree with me, Jivita and Bikesh, that hernia is not the DD of a testicular mass?
Yes, sir.
Yes, sir.
Okay, got it. Now, let's talk about it. So, patients present to you with a painless testicular swelling. Now, I have kind of narrowed it down to painless. So, obviously, if it was painless, obviously, it is not what you call as an epididymoarthritis. Okay, right. Okay. What do you suspect? So, you suspect, okay, so as I told you that what you are going to suspect, okay, it can be some kind of a tense hydrocele or an, let's say, hematocele, or let's say calcified sac kind of a thing of a hydrocele, or what it can be a testicular malignancy. Okay, so these are the differential diagnoses of what you call as your testicular mass. That's fine. Now, obviously, what we are here basically to talk about your testicular carcinoma. Okay, so if I ask you about your testicular carcinoma, what is a cause of a testicular carcinoma? Like, what is the most important risk factor for the development of a testicular carcinoma? Anybody? Yeah, Chivita? What do you, Irene, don't be afraid of me. Come on, are you kidding me? So obviously, if here you will not commit mistakes, where are you going to commit mistakes? And speak up. If at all you speak up, and if at all it is not accurate or something like that, it's okay, because now that is going to stick with you for a prolonged period of time. So just talk like friends. Just say whatever comes to your mind. Okay. So can I please have what is the most important risk factor for the development of a testicular malignancy?
Undescended testis.
Undescended testes. Okay. Cryptorchidism or an undescended testes. Okay, Jivita?
Yes, sir.
Yeah. Okay. Right. So the most important, important risk factor is that. Okay. So now I'll bore you with a couple of kind of percentages, which is all okay. 1% of all the male neoplasms, okay. 5% of all the urological cases, that's fine. 1 to 2% of the cases are bilateral. So can you tell me one testicular malignancy which tends to be bilateral? Which testicular malignancy tends to be bilateral? I'm pretty sure you wouldn't have come across that ever. It is lymphoma. Okay, testicular lymphoma. It's not a primary, it is a secondary testicular malignancy. We'll talk about that. It occurs more than 60 years of age. Usual occurrences like about the people who are more than 60 years of age, and the testicular lymphoma is something which tends to be bilateral. Okay. Now, predominant histology is the germ cell tumor, germ cell neoplasms, 90 to 95%. So, whenever we divide the testicular malignancies, you can divide them into germ cell neoplasm, non-germ cell neoplasm. The germ cell neoplasms can be divided into seminomatous germ cell neoplasia and the non-seminomatous germ cell neoplasia. Okay, you're all okay with this? Okay.
Yes, sir.
So the germ cell neoplasia, the seminomas are around, let's say, 50 to 56% of the total germ cell neoplasias, and the non-seminomas are around 44 to 48% of total germ cell neoplasias. Okay, understood? Right. 10 to 30% of the men present with distant metastasis. The diagnosis, yeah, metastasis is a bit early. So yeah, around 10 to 30% of the patients may present to you with the
लैंड तो तेरा हिमाचल में नहीं है, हिमाचल में नहीं है।
okay. So around what you call as 10 to 30% of the patients present with a distant metastasis and diagnosis. Okay, so that is what you need to understand over here. Okay, right. Now let's talk about the painless solid testicular swelling in the males. So let's talk about that. Painless solid testicular swelling in the males. Okay, so any painless solid testicular swelling which you kind of get in the males is testicular carcinoma until proven otherwise. Okay, so any what we call as a painless solid testicular swelling in the males is a testicular carcinoma until proven otherwise. Okay, so have you ever come across this particular concept that every patient of hydrocele you should get an ultrasound done? Did any of your consultants emphasizes on this, or sometimes they would have talked about this or something, or they kind of told you when you get an ultrasound done?
No, sir.
No, sir.
Like, do they encourage doing an ultrasound or not?
Do not encourage.
Do not encourage. Okay. Now, have you ever come across a patient who was operated in the periphery, considering that what the patient had a hydrocele, but when they kind of opened the sac, they found that what there was a testicular carcinoma or something like that. Have you ever come across such a patient?
Yes.
Okay. You will, like in your residency, at least a couple of times you will come across this. Somewhere in the periphery, somebody opened the sac, considering that that was a hydrocele, but when they opened it, it turned out to be testicular malignancy. So yes, I mean, if at all it's a very, very straightforward case, that's all okay. But if at all the transillumination, everything is kind of present, then it's fine. But let's say if at all it's kind of a bit calcified sac or a thick sac or something like that, you you cannot palpate the testes, right? You don't know whether there is a testicular mass present or not. Okay, because I'm pretty sure you would have heard of this. There is something just called the primary hydrocele and the secondary hydrocele. Secondary hydrocele is a reactionary hydrocele which occurs because of some underlying pathology, which includes your epididymal orchitis, testicular malignancies, all those things. So, if at all, maybe there is a testicular mass which has led to a secondary hydrocele, and then you're considering it a hydrocele. So it is good to get an ultrasound done just to evaluate the underlying testes. Now I understand that as a general surgeons, many times people really do not encourage that. They shout on you and tell you that what, it's a clinical diagnosis. Why the hell did you get an ultrasound and everything? But idealistically speaking, if at all you have even a slightest of a suspicion, you should get an ultrasound done to see whether the underlying testes are homogeneous or not. Did you understand the concept?
Yes, sir.
Yeah.
Yes.
Do you agree with this, or do you have some other opinion or thoughts in this?
No, I agree.
Right. I mean, see, try to understand. Otherwise, how will you, like, for example, if it all the testes is palpated separately, yeah, you can actually feel the texture of it or something. But if it all it's a tense hydrocele, you will not be able to feel the testes, right? So, in that particular scenario. Okay. So, yeah. So, until proven otherwise, painless hard testicular swelling is a testicular malignancy. Okay. Maybe secondary hydrocele, that's fine. But secondary hydrocele tends to be lax and negative transillumination, all those particular things. But if at all you have a suspicion in hydrocele patient, do get an ultrasound to evaluate the underlying testes. Examine the abdomen and the supraclavicular lesion, and lungs and the liver and the bones. That's fine. Why on earth do you want to examine the abdomen of this particular patient? Can you explain it to me? Why do you
Sir,
want to evaluate the abdomen?
lymph node meds first goes to
Not
aortic lymph nodes.
What is the first landing lymph nodes for the testicular malignancies?
Para-aortic
Para.
retroperitoneal lymph nodes.
Okay. So, Jivita, have you ever heard of this? Retroperitoneal lymph nodes or para-aortic or something like that?
Yes, sir.
Okay. Can you tell me why the lymph nodes go to the para-aortic or the interaortic cable or something? Okay. From where do the testes arise?
जहाँ सर ब्लड सप्लाई होते हैं उसका उसके अलोंग नोट्स होते हैं सर.
But blood supply abdomen से क्यों है? Because obviously you guys know that. I'm just trying
Because testis was initially abdominal retroperitoneal organ.
and then it kind of originates into the abdomen, and then it kind of gradually comes to line the scrotum. You all know that, right? Like descent of the testes. So because the origin of the testes is in the retroperitoneum, it takes its blood supply from there, and also the lymphatic drainage is basically into the retroperitoneum. Did you understand it? So if at all you are dealing with a patient who is very, very thin, you might be able to palpate the lymph nodes in the patients with the testicular malignancy. Okay, supraclavicular, we know that left supraclavicular, that Virchow's node and everything. Then lung, liver, and the bones. Yeah, like the hematogenous spread can basically go to the lung, then the liver, and the bones. All those particular places. Okay, now differential diagnosis, as I told you, calcified hydrocele or the organized hematocele. These are the differentials of your what do you call as a painless solid testicular swelling. Okay, now